All right, everyone. So we're going to go over some of the medications as well as going over some of the injections that can be given or administered to patients. Obviously, each clinic is a little different. Almost all clinics have a similar cabinet with medications in it, so familiarize yourself where everything is at. Mostly, or for the most part, on the top shelf we have the nebulizing solution. Make sure you know the difference between a duo nub that has two medications, albuterol by itself, or ipratropium. Familiarize yourself with the nebulizer machine as well as the masks, and we'll set up a video for that as well. So make sure you watch it and understand how that's set up. Second shelf is usually oral medications, so all these medications, some are liquid, some are tablets. Again, we're starting off with some Excedrin, Tylenol, aspirin, ibuprofen, Zofran, prednisone, Pepcid, which is famotidine, clonidine, some viscous lidocaine solution, prednisone, Mylantar, Maalox, ibuprofen, Tylenol, and Benadryl. So again, familiarize yourself with these medications, what they're used for, and when they're needed. Make sure that they're used appropriately. For the tablets and the liquids, make sure you guys have these little measuring cups or Dixie cups in stock to give to the patient, along with a bottle of water. Each clinic should have a little bit of a cheat sheet here with the brand name and the generic next to it, what it's used for, and some of the common dosages. So make sure you, again, are familiar with all of these. Next shelf down, we have injectables. There's quite a few here. Again, make sure you familiarize yourself with them. Some of them need to be mixed, like cefazolin, as well as ceftriaxone, which is known as Rocephin. And then the two most commonly used injectables are the dexamethasone, ketorolac, which is known as Toradol. But then there are others like Zofran, Benadryl, some cyanocobalamin, which is B12, as well as some of the lidocaines. And then keep in mind also lidocaine, xylocaine, or anything with a cane pretty much is used for almost pretty much the same thing, as well as mixing the ceftriaxone or Rocephin vial medications. And then also make sure you differentiate between regular and then with EpiPen, or epinephrine I should say. So there is a difference there. One is used to mix as well as to numb an area for a laceration, but if we have a bleeding laceration, the provider may ask you to give them some type of numbing agent like xylocaine that has epinephrine in it. So make sure you confirm that with the provider. In the next video, what I'll do is I will show you how we pull these medications into needles, how to log them, and then in a third video I will be uploading how to inject that medication into the two sites, the deltoid as well as the gluteus. Thank you.